homeopathy has been around for quite a long time. It originated in Europe by Samuel Hahnemann, and it's kind of funny because there is a school in Pennsylvania called the Samuel Hahnemann Medical College, and basically homeopathy in the early 1900s was quite evident in the United States. In fact, there was 22 homeopathic medical schools in over 100 homeopathic hospitals. And basically the theory behind homeopathy is that likes cure like, and what it is they take very small dosages of something that they have diluted down, whereas if a person took that in larger doses, it could cause symptom or an illness. And what they do is they take these and they put them into your body to help stimulate the immune system, to help assist the body to healing itself.
Oh, it's about stimulating the immune system. I never picked that up on homeopathy. That's how it works.
Well, we have to realize that, you know, it does, and it does a lot of other things with it. And when they take certain remedies, and these remedies have to be diluted by a series of steps, and what happens is by putting these remedies, it's just like if you go to a doctor when you have allergies and you get those weekly shots. They're putting a small amount into your body, hoping the immune system will have a reaction to that, so that when you're introduced to a larger amount of that allergen, that your body will respond differently.
Now, ladies and gentlemen, I want you to know that we have been looking at doing shows on alternative medicine on Medical Matters for 2 years. This is the individual we picked. He's a great speaker. I really enjoy hearing him talk.
Well, thank you. I appreciate it.
But what is naturopathic medicine, continuing on our trip around the world of alternative treatments?
Well, naturopathic doctors or naturopathic medicine, there are accredited schools where you actually go get your naturopathic degree. And naturopathic uses a series of modalities, and they may use some diagnostic, they may be using some blood tests. And again, they're going to use different things such as herbs. They may use some massage. Some naturopaths are trained in massage as a side training. So they use different modalities to try to get the body to assist it in its healing process. And we have to realize that with naturopathics, and most people don't realize that in some states, naturopathic doctors can actually prescribe general medications.
Right, and it's an interesting point, ladies and gentlemen, that not all naturopathic practitioners are equal. I mean, some have gone to four-year medical school, some have taken a class on the web. So I don't know how you differentiate those two, but there are different types of naturopathic physicians. Did you know that, as I understand it, 14 states in the United States right now license naturopathic physicians and allow them to treat patients? Mm-hmm. Ohio at the present time does not license naturopathic physicians. That doesn't mean that they can't consult. They can, but they don't license them. Why is it that Ohio hasn't allowed naturopathic physicians? Now, we're in many states, but what about Ohio?
Well, it's not that they don't allow them, it's just that they don't have a licensing board that oversees them, and I think it's something that is needed. And I think it should be done by the group of naturopathic doctors and not by the medical board, for the reason being is that, you know, the naturopathic doctors have been through the school and through the training. They know what type of education, what schools are accredited, so that when everybody comes in, they're allowed to take these state board exams just like I had to, and just like a medical doctor has to when they come to a particular state, to make sure that this individual at least has enough education behind him, because we have to realize that these doctors are dealing with people's health.
Right. Well, if 14 states have figured out that it's okay to license naturopathic physicians, I think we have to ask the question, why not? I mean, who's right? You know, the ones that have said yes or the ones that are saying no? It could just be that some of the states are behind the times a little bit. I don't know the answer to that.
But at this time, they are actually trying to form a naturopathic board, and so I expect to see it in the future.
Right. What is iridology?
Well, iridology has basically been around for many, many, many years also. And, you know, most people, when you talk about looking into somebody's eye, and you can look at, many, many years ago, they found plates back in the 1700s, I believe, where they actually had drawings of structures of eyes. And what they do is they kind of map out the iris. In different regions correspond to different parts of your body. So if there's some inflammation or you have a problem, you might be able to pick that up into the eye. Now, iridology is not used to diagnose people, but you have to realize, does it have validity? Absolutely. I've taken courses in iridology, and we have to realize this. It's just another window into the body to give you some more information or a clue that you may not pick up on a lab test, that you may not pick up on a regular physical examination. So as iridology says, it's the eyes are basically the windows into your body.
What is functional medicine as you define it? And I think that that relates to how all this alternative medicine, including chiropractic, most people are familiar with chiropractic, but how do all those fit into your healthcare?
Well, first of all, functional medicine, in my opinion, will be the #1 leader in alternative medicine. And we have to realize that in functional medicine, if we look at the word function, we're going to look at how the body actually functions as a whole. We have a series of glands and organs called the endocrine system, and these things communicate with one another. They release a multitude of hormones, and these hormones are basically chemical messengers that go through our body and actually tell our cells what to do. And so with functional medicine, we not only look at if somebody comes in and let's say they have a thyroid problem, we're not only going to address their thyroid problem, we're going to look at the whole endocrine system, such as their adrenal glands, maybe their GI tract, maybe their hormone levels. And we have to realize that our body, in conventional practice, our body is viewed as, if you have a deficiency in an organ or an organ is suppressed or it's not working properly, they put you on a drug or a medication to try to improve the function of that organ. But in reality, in functional medicine, what we try to do is we try to increase the function of the whole endocrine system. And by doing that, we're able to actually balance out the chemistry and allow the body to function at its optimal level.
What would be a good application of alternative medicine, and what would you, in your opinion, is an inappropriate application?
Well, I mean, a good application of alternative medicine, in my opinion, all of them can be good applications on certain individuals. We have to look at it. I don't group anybody into one class. We're all human beings. We all have different personalities. We all have different chemistries. And you have to, #1, evaluate the patient to see what maybe alternative medicine technique or practice or modality may be beneficial for that patient. I haven't heard of any that's caused major problems, because believe me, if something that was alternative medicine caused a major problem, they'd be in there shutting it down very quickly. So a lot of the stuff we use are just general things to guide our body and to assist our body down the road to health, and they're not going to be dramatic things that could cause major problems. But we have to realize, a lot of people out there are reading things on the internet and they're starting to slap on progesterone creams and they don't know if they need that hormone or not. I think, to me, that's probably one of the scariest things people can do, is actually start putting hormones in their body and not even measuring their hormones or have a baseline on their hormones. And we have to realize, that sometimes they're given these hormones through doctors and they haven't been tested neither.
Right. And of course, something that Dr. Unger and I have talked about is that if you're going to utilize alternative medicine, be it herbs or vitamins or whatever, or major diet changes, exercise, whatever it may be, it's always a good idea to run it by your MD or DO for their input, and so that they know. Because a lot of the herbs actually can change the way blood coagulates in a surgery. There's things that a doctor, he needs to know. But 60% of Americans each and every year are going to utilize alternative medicine. So it is a growing area.
Yes, it is, and I agree with that, because they have to know, especially if you're going in for surgery, because that could affect the surgical procedures, and be upfront with your doctor. A lot of people are afraid to tell them, and the reason being is because they feel that their doctor is going to tell them that doesn't work at all and you don't need to do anything.
Now, what can people who are viewers of this show find on the website?
You can go to my website, and basically you'll find a lot of information about alternative medicine, about the testing that we do in our office, and more importantly, you can go and educate yourself on different topics, women's disorders, thyroid problems, blood sugar problems, diabetes. All those things are on the website, and keep coming back because we keep updating it.
Very good. Now, in terms of, is there anything really major new happening on alternative medicine that's on the horizon?
I think some of the newest stuff coming down the pipeline is basically what we call energy medicine or frequency medicine. And I think it's going to change the way medicine is practiced if it is allowed and it doesn't get shut down by certain governmental agencies.
Very good. Well, this has been an absolutely fascinating show for me. We've covered a lot of ground on alternative medicine. I certainly want to thank Dr. Keith Unger from the Center for Natural Medicine for coming with us today and to share with you a little bit about natural medicine. See you again soon on Medical Matters.